What is being done at the community level as concerns around negative psychological impact of social isolation rises with the increase of suicide rates. The number of people looking for help with anxiety and depression has skyrocketed from January through September 2020. According to Mental Health America. During that period, more than 1.5 million people took a mental health screening available on the MHAnational.org's website. The number of people reporting moderate to severe symptoms of depression and anxiety has increased throughout 2020 and remains at higher rates than before the pandemic. Of the people taking the MHA screening, there was more than a 93% increase in anxiety screenings and a 62% increase in depression screenings compared to 2019, the MHA said. The organization says that more people are reporting frequent thoughts of suicide and self-harm than have ever been reported to the MHA screening since its launch in 2014. Since the pandemic began in March, over 178,000 people have reported frequent thoughts of suicide ideation, with a 37% people reporting having thoughts of suicide more than half of nearly every day in September of 2020. Young people between the ages of 11 to 17 years old are struggling with their mental health and are more likely than any age group to score moderate or severe symptoms of anxiety and depression. Rates of suicide ideation are highest among youths, especially LGBTQ+ youth, according to the MHA. African Americans and Native Americans are disproportionately impacted by the increase of high suicide rates and suicide ideation than any other racial groups. People who are identified as at risk for mental health condition are mostly struggling with loneliness or isolation. From April to September of 2020, among people who said they had moderate to severe symptoms of anxiety or depression, 70% reported that one of the top 3 things contributing to their mental health concerns was loneliness or isolation. Dr. Christopher Pittenberg, a psychiatrist and a director at the Yale OCD Research Clinic at the Connecticut Mental Health Center, suggests people try finding ways to maintain a sense of normalcy while also understanding that things likely won't completely return to normal for months. Technology is useful in that regard, he said. Dr. Pittenberg suggests that staying in contact through a phone, computer, or other means is important because it maintains some degree of normalcy. Connecticut has a mental health portal through which a number of services can be accessed, including support for young adults, a parent stress line, a veteran line, a teen talk line, support for LGBT+ people, and those who speak Spanish or another language. You can also call 211 for more information. The National Alliance for Mental Health Connecticut is hosting several online support groups and educational programs that are led by trained facilitators with experience in mental health issues. These are currently 10 family support groups, 11 peer support groups, 2 veterans support groups, and 6 young adult groups. To learn more, visit www.ctcps.org.